So I thought I would quickly show you how we treated her. And to get the left pubic bone to glide forward, we placed this piece of 2-inch tall foam underneath that ischium, and we did that for 5 minutes. And then after that, we took that away, and to treat the right anterior ilium, we created a force parallel to the angle of the SI joint on the right, and she hugged her knee outside of the right shoulder, and she did that for 2 minutes. And then to treat the left posterior ilium, we moved both legs over to the right, and we placed this foam underneath the ilium on the left and had her position like that for 2 minutes. And then we started to treat the lower windswept pelvis. And so the goal was to bring the lower pelvis on the left toward midline. And that was accomplished by crossing the leg over like this. And then we stretched that left hip into adduction, crossing the midline. Did that stretch for 2 minutes. And then to bring the right lower pelvis out to the right, we stretch the right hip with a little bit of traction, a little bit of downward force, and then stretching it outward into abduction. Now, would you lie on your stomach, please? And there is a rotational element. With that lower windswept, there's also an outward rotation to the left, and we treated that by rotating the right hip into internal rotation for 2 minutes. And then we stretched the left hip into external rotation and blocking the pelvis so there's no twisting going on into the lumbar spine. After that, I treated the coccyx by isolating the coccyx and then gathering the ligament and soft tissue on the right side and basically pulling that coccyx over to the right, and we did that for 3 minutes. Then I came and got onto the left side of the coccyx and then pushed it over to the right. So let's have you lie on your back, and we'll show you the changes that we accomplished. Now again, I don't know if the camera angle can capture this or not, but the pubic bones are symmetrical on the upper, middle, and lower face. And if we walk across, there's just a straight glide straight across. So there's no longer a step down. Pelvis looks much more symmetrical. I can take up the slack. You can see there's movement throughout the pelvis when I do this, and I get to an end point. And at that point I can spring it, and there's a forward thrust and a recoil, okay? And then when I let go, there's that final recoil. So let's have you lie on your stomach now. And you'll recall with that posterior pubic bone on the left ischium had blocked mobility, and now I can take up the slack and I can spring it and it bounces. The posterior ilium on the left blocked superior glide mobility, and now I can see even her head move. So I can take up the slack there and I can spring it and bounces right back. And I think you'll recall that there was a lack of inferior mobility on the right side, and I can see her heels bob up and down, so the force is translating through the SI, through the hip, down to the lower extremity. And then the coccyx was a positional evaluation, and I'm within the sulcus, and you might want to get a close-up of that. I don't know if the camera will capture that or not, but the sulcus are symmetrical. So can you describe to us how you felt after I treated, and then you walked around, and then you sat?
I feel a lot more mobility through my hips and through the SI joint, and I also feel that the ligaments feel like they are not so tight anymore and not restricted.
And you were especially pointing to this lower medial region on the left.
Yes, that feels much more freed up.
Very good. So I'll let you wear this today and see how it feels and see how it responds to all your activities. and then you'll come back tomorrow, and then I'll teach you a couple of very, very simple stretches to keep this mobility. And let's do one more view from below, please. And there is much greater symmetry with respect to medial lateral positioning. It's not perfectly symmetrical. There still is a little bit more width on the left side, but it's definitely improved over what it was initially. So this was an example of a complex pattern in the pelvis slash sacroiliac slash pubic joint and hips. And it's not always a single diagnosis, and this was an example where she had 1, 2, 3, 4, 5 things going on, but responded very well to treating motion. And this is again a mobility-based evaluation, not based on how things look, and driven by the spring test mobility testing. So thank you very much.